Auzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Everyone is here. May I know how many students for this group?
Seperti 30, Doktor.
30? 30. Okay. So currently we only have, okay. Try to wait for 2 minutes or let them to join, and then after 2 minutes I'll start the class. Okay. So, Bismillahirrahmanirrahim. So, for today's lecture, I'm going to cover on the radiation, hazard, and protection. So, before start our class, let's recite Ummul Kitab Al-Fatihah. Okay. So this is the outline for today's lecture. So I'm going to cover on the hazard what's the hazard from the ionization, okay, and then what's the effect of radiation to the human body, and then touch a little bit about the radiation protection based on the Act 304, and what's the protection that required to protect ourselves from the radiation hazards. So a little bit introduction, I think, about the ionizing radiation. So we know that there are radiation classified into two: ionizing radiation and non-ionizing radiation. So in a medical, in radiology especially, we use ionizing radiation for the diagnosis. And then in a radiotherapy, they use ionizing radiation for the treatment. So ionizing radiation can be hazard, even we know that it's very beneficial for diagnosis and then for the treatment for certain cases, but it can be hazard because ionizing radiation, when it interacts with matter, it can produce changes at a molecular level. Okay, damage by the ionizing radiation can cause by direct or indirect ionization. Okay, we know that I think this the basic. Okay, I think the previous lecture I touched about the basic interaction of radiation interaction. Okay, radiation can be absorbed. Okay, for example, this is the body. Okay, so radiation can be absorbed by the body. Some radiation can penetrate through the body without absorption, and some of radiation might be scattered. So, uh, so, uh, f- the when the radiation is absorbed by the body, so this radiation may cause damage to the to the tissue, to through the human. So the damage by the ionizing radiation can cause by the direct or indirect. So when the radiation or the radiation attack or emitted and absorbed by the body, their target is the DNA. The radiation will attack the DNA. This is because DNA is the most important cellular constituents to be damaged by the radiation. So the target of the radiation is DNA. Okay, so how cell can be damaged by the radiation? Okay, um, so biological effect. Okay, the damage by the cell influenced by the sensitivity of the organ, also of the tissue, and also the type of radiation that emitted or absorbed. Okay, for example, for the same amount of energy. For example, we give example for gamma. Okay, 5 gamma, and then we also have 5 alpha. So the damage by 5 gamma and 5 alpha is different because of the type of radiation. So there is another. There is a two. Basically, there is a two factor that affect that affect, okay, the effect or the influence the biological the influence of the biological effect. So the tissue or organ, for example, as a gonads, they have a high level of sensitivity to the radiations. So for example, okay, 5 centigrade of radiations when emit, okay, when we expose to the gonad, and 5 centigrade of radiation to the skin, the difference to the particular tissue or organ is different because of the level of sensitivity of the tissue or the organ. Okay, so biological effect, we know it can be direct and indirect. So for direct, easily it is for very high low energy linear energy transfer. So for example, alpha, because you know alpha is very hazardous and very harmful to the humans. Okay, most of the interaction or most the cell here in the human was damaged due to the indirect by the indirect effect. Okay, what is the indirect effect? So when the radiation, so this is the radiation, X-ray and gamma ray, interact or absorb. Okay, when the radiation is absorbed to the body, okay, it will interact with water. Why water? Because water is the most common in a living tissue. So because our body also consists 70 to 90% of the water. So the radiation will interact with the water, and radiation is absorbed, and then it will interact with the water to produce free radicals. So these free radicals, okay, this free radical is very highly reactive and powerful oxidizing agent to produce a chemical modification. So this free radical will lead to biologically harmful products. So it may damage the reaction intent. So when the free radical here, because we know that free radical is very highly reactive and very powerful oxidizing agent. So it will attack DNA to produce a damage. Okay, compare to the direct. So the radiation, for example, the alpha particle, it directly attack the DNA without interact with the water. But for indirect, okay, it will help. It need to produce a free radical before can attack the DNA. Okay, before can damage the DNA. So once the DNA is damaged, either by direct or indirect, DNA have a possibility to repair, and then or it cannot be repaired. Okay. So either one. Possibility for it to repair is high if the damage was caused by the X-ray or gamma ray. But the possibility to repair if the DNA was damaged by the alpha particle or by the direct interaction is very less. So the DNA will repair or none be repaired. So if they can be repaired, so it can back to the normal tissue. But sometimes it try to repair. Sorry. Sometimes it try to repair, but it failed to repair, so it can cause a cell death. Okay. So I think I touched a little bit just now about the biological effect. So the biological effect is depend on the type of radiation I mentioned about. For alpha, X-ray, gamma ray. Also, the type of these radiations influence the biological effect. The alpha is very harmful to our body, so the effect that was caused by the alpha particle is much greater than the gamma or X-ray. It also depends on tissue and type of cell, because our body has different level. Every tissue in our body have different level of the sensitivity. So for gonad have a higher level of sensitivity compared to the skin, and similar to the lens. Okay, also have a high radiation weighting factor, or radiation weighting tissue weighting factor, that influence the sensitivity of the tissue towards the radiation. It also depends on the dose, and also the dose rate. Okay, for example, if we expose a person or a subject with 10 sievert per year, 10 sievert in one shot, the effect to the particular matter, the cell will dead. But for the similar 10 sievert, but we expose it in two fraction, mean one fraction is 5 sievert and another fraction is 5 sievert, but within in certain period of time, so the possibility for the cell death is less than 100% compared to if we shoot with 10%, 10 sievert per shoot. Okay, similar if we shoot or we emit a subject with that total 10 sievert, but in a period of 50 years. So for 50 years, the total amount of the total amount received by the matter is 10 sievert, but the possibility of the cell to death is less, or no possibility of the cell to death, because of the dose rate received by that particular cells. Okay, this is what I mentioned about the level of radiation sensitivity. So lymphoid tissue, bone marrow, and a gonad, they have a high level of sensitivity. So small intestine, islets, and hair follicles, okay, also have the higher, but it's not very high as the previous one. And then the bone, fat, and nerve cell have the lowest radiation sensitivity. Lowest radiation sensitivity compared to others. Okay, so the radiation, when they emit and we absorb, when the body absorb the radiation, okay, it will produce an effect. Of course, there is an effect to the human body. So the biological effect can be divided into somatic and genetic. Okay, what is somatic? Somatic is this effect only for the particular person that was received an exposure. Okay, you receive the exposure for 10 sievert. Only you will get the effect from the radiation, and it cannot be inherited, or it cannot be inherited to your generation. But the genetic here is the maybe the effect of radiation can be inherited from the other generation. So the effect of radiation can be divided into two: deterministic effect and the stochastic effects. So what is the deterministic effect and what is stochastic effects? So okay, so deterministic effect is the effect that can appear after at least 2 or 3 months of the exposure. Okay, you can see the effect of radiation. Maybe some of the effect you might not need to wait until 2 or 3 months to see the result. Might need only 2 or 3 weeks for you to see the result. Okay, deterministic effect, they have a threshold, and you can easily find the relationship of the effect with the radiation. Okay, for example, let's say about the radiation treatment. Okay, because we know that when we talk about the radiotherapy, we expose the patient with a very high energy of radiation, because we want to treat the patient, because we want to kill the patient. Okay, so for example, a case for a breast cancer, the total radiation of exposure for treatment for breast cancer, it need 4,005 centigrade. 4,000, for example, I give the example for breast treatment, for breast cancer treatment in radiotherapy. Okay, it need to shoot patient with 4,005 centigrade. This is the total fraction, total radiation. Okay, it need for the treatment. Okay, so maybe after a few exposure, for example, 4,005 for 15 fraction. Okay, maybe after a few fraction, for example, after a 7 fraction, means after a week of the treatment, you can see that at the skin of the patient there is a redness or something. You can see the skin start to become a red, and the skin maybe start to burn. Okay, that is the effect of the radiation received at the treatment area. So this is an example of the deterministic effect. Okay, deterministic effect, has a threshold. Okay, what this mean is mean by, okay, if the person is exposed to the radiation, and then it doesn't exceed the certain threshold level or threshold dose, no effect can be seen on the person or on the subject. Okay, for example, okay, for those, maybe for example, I just give an example. Okay, if you want for skin erythema, for example, okay, maybe it need for example, it need 20 centigrade. For example, it need 20 centigrade as a threshold level. But when exposed below, when the radiation or total radiation received by the subject is less than 20 centigrade, there is no effect you can see. But once the radiation reach the threshold levels or more than threshold levels, or you can see the effect of itself. So if the absorbed dose is more than 20 centigrade or 20 centigrade, you can see the the effects are due to the radiation itself. Okay, the second type of damage is the second effect is stochastic effect. So stochastic effect, it is associated with a low doses. So this appear after a long incubation period following exposure. This effect, we cannot predict the occurrence or the severity in the individuals. So there is no threshold for this effect, and the causality between the relation is often difficult to find. Okay, for this domestic effect, it is easier for us to mention that okay, this is due to the radiation. This effect was you had to swallow. For example, for NPC case, okay, for NPC case, the treatment for the patient NPC cases, cancer. So sometimes after a few treatment, they have difficulty in swallow, they lost appetite, they have difficulty, or their hair start to fall. Okay, so we can easily say that this is the effect of the radiations. This is the effect of radiation. So we can easily find this causality of this effect and the radiation. However, for the stochastic effect, it's very hard for us to come into conclusion or come into discussion that this is due to the radiation, because it is associated with low dose. Maybe the loss from the first day of your life to your 50 years of your life. So maybe it's due to that, the total of exposure of your body to the radiation. So it's very hard to predict the occurrence or severity of this stochastic effect, because it also have no threshold. Okay, so this is the example. This is a graph of deterministic effect. So this is the threshold levels. So once the dose received absorbed dose by the body is below the threshold level, there is no effect. But once it reach or touch the threshold level, you can see the effect started to show up. Okay, so when the number of people exposed to the same dose of radiation and certain symptoms appear in 1% of them, said dose is considered to be threshold dose. So example of deterministic effect here: hair loss, cataract, and the skin injury. So stochastic effect is the effect that you can see after a very long time of period after your exposure due to the cumulative of the low dose that you receive, maybe from the one as I mentioned. So example is a cancer, leukemia, or also possibility of the hereditary effects. So effect of radiation exposure under certain doses are not clear, because effect of other cancer promoting factors such as smoking and drinking habit are too large. However, ICRP specify the standard for radiological protection for such low exposure, assuming that they have some effect as well. Okay, so stochastic effect, this is the effect you can see after a long time, as a long period of time, and there is no threshold. Okay, this is example of the effect of radiation that might be received by your body when you're exposed to 5 to 10 rem. Okay, rem is a unit, conventional unit of exposure of radiation. This is conventional unit. Okay, 5 to 10, maybe you can see any changes in the blood, and maybe if you exposed to the 50, maybe they can feel a nausea. And then, for example, if exposed 75 rem, possibility of the hair loss, you can see the effect of radiation is hair loss. But when you expose 1000 or start 400, there is a possibility for death. And 4000, okay, for possibility of death, but 4000 is the probability of death is 100%. Okay, now but Now we touch about the somatic and then about genetics. So genetic effect, there is evidence of ionizing radiation causing heritable mutation in many plants and the animals. So therefore, it assumed that heritable mutation also occur in human. However, this genetic effect it's all still in debate. There is no solid proven or solid documentation that mention that genetic effect there is a genetic effect on the radiations, but they did a study in plants. They did also study in animals, so they assume that there is maybe a potential for the heritable also occur in the humans, but there is no evidence. But so they still study about this, about the genetic effect. Okay, so that's about the radiation protection. So when we work or we step into the in the apartment with the radiations that deal with ionizing radiation. Okay, so at least you have to know about, or at least you have a knowledge about the radiation protection. What should you do for you to protect yourself from get hazardous or from the radiation? The radiation is beneficial for the patient, but but of course, if you are not the patient, you as much as you try to avoid from any excessive radiations. So so radiation protection has the objective to prevent the occurrence of deterministic effect and to limit the acceptable level of the occurrence of the stochastic effect of radiation. So this is the objective of radiation protection. They don't want to have to they want to prevent from the deterministic effect. Okay, and they want to limit the occurrence of the stochastic effect. Okay, there is a three important principle in a radiation protection. Okay, the first one is justification. The second one is the optimization, and the third one is the dose limitation. So justification, optimization, and dose limitation. This is three important principles when they talk about the radiation protection. So radiation protection, what is the justification? Okay, there is no unnecessary use of radiation is permitted, which means that the advantage must be outweigh the disadvantage. Before the procedure need to be performed, okay, need to be performed, okay, in a radiology, so it have to be a justification for these cases. Why they have to justify either these cases should perform this examination, or should undergo this examination in certain modalities. If there is if there so of they need to make sure that once they proceed with the procedure, okay, the patient get the beneficial from that examination. Okay, and then for examples, okay, if there is any option for the patient for not to perform the examination with ionizing radiation, they should go to the non-ionizing radiation. Okay, for example, okay, maybe there is a PITS patient. Okay, so okay, maybe they complain for the maybe stomach ache. So are you really need to perform the examination? For example, you need to perform the CT scan for this patient. Maybe they just can go with the ultrasound, which is non-ionizing radiation and less harmful to the patient. So this is justification. So in a radiology, usually before they decide for the certain procedure, there is a process vetting that is conducted by the MO and also by the radiologist before they can proceed with the procedure. So the second one is the optimization of protection and safety. So the second principle is the optimization. So under optimization, radiation should be escaped as low as reasonable achievable or ALARA. Okay, what is ALARA? ALARA stands for as low as reasonably achievable. So make sure there is optimization. So the dose keep low. Okay, but of course, we have to compromise lah between the dose and the image quality. Okay, they have to play around with the odd because of course, okay, we want to they want to keep the dose to the patient as low, but we have to compromise the quality of the image. So that's why that is what's the definition of the optimization. And the third principle is the dose limitation. Each individual must be protected against risks that are far too large through individual radiation dose limit. Okay, we have dose limitation. Every group of every group have their own dose limitation. For example, for radiation worker, who is radiation worker? Radiation worker is the person who work or the nature of his or her work is with a radiation. For example, radiologist or X-ray, okay, our X-ray, and also maybe the therapies. Okay, there is the nature of their work is dealing with radiation. So for radiation worker, they have their own dose limitation. For public, they also have their own dose limitation. And also for patient, okay, for patient they don't have any dose limitation. Why? Because we know, because it's back to the so back to the second principle just now is about optimization. Because our concern for patient, if we want to make sure that the patient get the more benefit from the exposure from the radiation, okay, from the diagnosis. So for the patient, they don't have the dose limitation, but they come back to the second principle, which is optimization. Okay, justification of practice. This is I mentioned about the first principle, which is justification. In proposed and continuing practices, the justification of practice must be such that the work uses radiation because it gives benefit to the exposed individual or the society exceed the radiological risk. The second one is about the optimization. The second principle, the optimization. So it's referred to the principle of ALARA principle, as low as reasonably achievable. So it focuses to produce a best possible image quality at a minimum risk to the patient. So it's about the complement each other. Okay, we don't want to sacrifice the patient by exposing him or her too much to the radiation just to get the best possible image. But we just want to this is the time where the X-ray so for the for the staff to have there is important for the staff to have a skill, okay, the important knowledge for them to make sure that okay they can get the best possible image quality at a minimum risk or maximum exposure to the patients. Okay, so based on ALARA principle, they mention about the time, they mention about the distance, and they also mention about the shieldings. So based on the concept ALARA, time, distance, and the shielding. So less time spent near source or less radiation for the less radiation received. Okay, for certain procedure that we need to be stay with the patient and the source, for example, in a fluoroscopy procedure, angiography procedure, we have to spend the time with the patients. So we have to make sure that for in the ALARA, the first concept of ALARA is to spend less time to the source. So less time, less radiation received to the body. Okay, the second principle is the distance made to keep yourself away from the source. Okay, if you really need to stay with the source, try to stay farthest from the source. So greater distance from the source, less radiation received. Okay, I think this is most of us apply, or more of you apply when you see a general mobile X-ray coming in the world. Okay, when they start shooting, of course, everyone are still everyone will try to avoid to be stay together with the patient and to be a greatest distance from the source for less radiation received. So this is based on the Investigate law, where is the greater distance, less intensity or less radiation received. So for okay, I touch about the mobile X-ray. Yeah. So the mobile X-ray, the principle is you should the minimum, okay, the minimum distance for you if you stay around the close to the patient or to the modalities or X-ray machine, the distance it should be less within 2 meters. So if you stay more than 2 meters, it means that you are in a great distance from the radiations. Okay, the second concept is the shielding. So every source, okay, radiation source, for example, alpha, okay, and gamma, they have their own different calculation for the shieldings. So if you have to stay in a fluoroscopy, or if you need to certain procedure that you need to be stay with the patient, or in the room, okay, in a procedure room. So if you can stay behind the shielding, so it is better because less radiation received. So this is a three basic principle of ALARA, which is time, distance, and the shielding. Less time spent to the near source, greater distance from the source, and the stay behind the shielding. Okay, so the shielding. So the material used what is the shielding? This is a material used to attenuate radiation and provide radiation shielding against the external exposure. So it have to construct a shielding, it have to be considered the density, the thickness, and also the quality of the radiation. Okay, so the quality of radiation, as I mentioned, about how energy you use for that room. Okay, what kind of radiation? Either it's a alpha, is it beta, or is it gamma? And then how about the workload of itself also have to take into consideration to construct a shielding. So selected shielding is depends on type of radiation. Okay, for example, for alpha, you can stop the alpha by piece of paper or by hand. But for the gamma, you might need a concrete to stop the radiation from penetrate. This is one. Alpha, beta, gamma, and neutron. So for alpha, you might need just a paper, or it also can stop by your skin. But for beta, it need aluminium to stop the penetration. For gamma, it can penetrate paper, it can penetrate aluminium, but it cannot penetrate lead. So that's why mostly, okay, I think all of the facilities, okay, with ionizing radiation, okay, they use a lead or at least lead to store or as a shielding. to stop the penetrations. So neutron also, for neutron it can penetrate lead, so but it can stop by the concrete. So I think most of the premise they use or lead or concrete for as a shielding. Okay, there is a dose limitation. Okay, the dose limitation, the if you remember the third principle of the ICRP, the third principle of radiation protection, first one is the for justification, optimization, and also the dose limitation. So the third one is the dose limitation. So the dose limit used to apply control on each individual accumulation of dose. So we have a dose limit. So this dose limit to control the individual accumulation of dose. So this is not a line between the safe and the dangerous. So we have the different dose limit for the member and also for the radiation worker. Okay. Okay. This is an example of this limit for occupationals exposure in a medical, and also the dose limit for the public. So the effective dose that received by occupationals, there's recommended it to receive maximum 20 millisievert per year, average over defined period of 5 years. So for public, the dose limit for the public is 1 millisievert per year. Annual equivalent dose for lens for occupational is 20 millisievert per year. For public is 15 millisievert per year. For the skin, it is 500 millisievert per year for occupationals or radiation worker, and 50 millisievert per year for the public. For hands and feet, it is recommended for the radiation worker to receive maximum 500 millisievert per year, and for public is 50 millisievert per year. So how we want to monitor the dose received by the radiation worker? That's why we have a radiation detector. Okay, that's why we have a radiation detector. We have our personal monitoring dose to monitor the dose received by the body. So protection against radiation hazard. So okay, in when you step into a department of, for example, department of radiology, okay, every part of your work, every area in the department already is classified by either it's a clean area, it is supervised area, or it is a control area. Okay, so what is a clean area? The clean area is where annual dose received by a worker is not likely to exceed the dose limit for a member of the public. Means the area, the clean area, the dose, okay, the contamination or dose received for the person who stay here should not exceed the dose. The area should not exceed the dose limit for member of public. Okay, what is dose limit for the public? 1 millisievert per year. Okay, so this area we consider as a clean area. We also have a supervised area in a department. So the supervised area is the work area, which the occupational exposure condition are kept under review even though specific protection measure and safety provision are not normally needed. Okay, for example, maybe the control area. Okay, so it's an example of an area. So we also have a control area. The control area is work area where the specific protection measure and safety provision should be required for controlling normal exposure or preventing the spread of the contamination during normal working condition and prevent or limiting the extent of a potential exposure. So if you enter the control area, so everyone that enter the control area required to use the radiation protection equipment, okay, to prevent and the spread of the contamination. For example, for the procedure, for the fluoroscopy procedure, okay, the MO, the radiologist need to entertain the patient during the procedure by stay with the patient for the procedure. So for that situation, okay, the fluoros room they consider as a control area for, and then for everyone who enter the room during the operation, they need to wear the specific protection measurement, or they have to have us they have to wear uh, the radiation protection equipment to avoid for any excessive radiation. Okay. So radiation protective equipment, what's the function of radiation protective equipment? They want to reduce the risk of radiation exposure from internal radiation exposure and a contamination, radiative contamination. So radiation protective equipment used to complement others means of radiation hazard control already in place. Okay. This doesn't mean that you use RPE, you use a radiation protective equipment. It doesn't mean that you are totally safe if you are not apply the radiation the three basic principle of the radiation protection, and also if you don't apply the basic principle of the ALARA, which is time, distance, and shielding. So even we use the radiation protective equipment, we also have to have to apply the ALARA principle in every procedure, in every task. Okay. Radiation protective equipment should be worn by the personnel whenever he or she cannot remain behind the protective barrier during the exposure. That's why you see the radiation worker in the department, all the staff in the department, they have their own personal dosimeter. So this is personal dosimeter that used to they are going to the personal dosimeter here, they are going to send to the authority, or for here example in SASMEC we use to agency nuclear. So agency nuclear will analyze the dose, and then they will come with a record or report how many dose received by that particular person per month. So this is how they track the dose received by the radiation worker. Okay, radiation protection to the personnel. So, okay, utilize shielding available. This example of radiation protection for the personnel or radiation worker is a lead apron, glove, thyroid shield, lead goggles, and then what should be the what as a personal or radiation worker, what should he do to make sure that he or she doesn't receive any unnecessary exposure? If possible, stay behind the lead barrier during the exposure. Whenever she doesn't need to be there, okay, it's better for he or she to stay behind the lead barrier. Keep distance from the source of radiations, distance from the patient during exposure, distance from the X-ray machine, and wear a personal monitoring. Okay, this is example of personal monitoring. This is pen dosimeter, or some call it a pocket dosimeter. Okay, this is pocket dosimeter. You can put into your inside your pocket for radiation monitoring. Okay, this is common. I think this most of you are really familiar. This is OSL. This is our personal monitoring, and this is the film badge. Okay, this is okay, during maybe a few years back, we use film badge as a personal monitoring, but currently all of the permits they moved to the OSL, and this is similar like the pen dosimetry. Okay, and this is the ring dosimetry. Okay, ring dosimeter. So this is usually we use here for a personnel or for radiation worker that deal with a radiation. For example, in a nuclear medicine, so with nuclear medicine, they need to prepare the source or radionuclide or radioactive for the treatment. So they are recommended or advisable to wear a ring dosimeter as a protection. Okay, so as a patient, what's our protection to the patient? Reduce or avoid any repetition as much as we try to avoid for any repetition. So minor repetition, low repetition, no unnecessary exposure to the patients. So use immobilization device. So for the patient, if you see the patient, you cannot give cooperate or cannot cooperate for the procedure, so it is recommended to use immobilization device. Okay, so of course, because when the patient is moved, okay, of the image that will produce after exposure is not as we required. So if the image produced is maybe blurring or there is a motion artifact, so the procedure need to be repeated. So it is there is we have to perform the repetition. So of course, when the repetition is come back away to the unnecessary radiation exposure to the patient. Okay, there's patient shielding. Okay, patient have their own right to make sure that uh, they doesn't receive unnecessary radiation. Okay, for example, if you only want to, if only for certain procedure, there is no requirement for you to expose a gonad. So it is recommended for the staff to provide a patient shielding or gonad shield for the patients. Okay, so there is also the policy of patient pregnancy. Okay, the patient. Okay, what is the policy of pregnancy patient? They are going to treat or to examine the patient who is a pregnant patient with ionizing radiation. Okay, if yes, what is the policy for them? Okay, for example, for a patient who are pregnant and need to perform uh, a CT brain, for example, you really need to perform a CT brain. So make sure the abdomen area is covered. Okay, so they will because there is not the interest area or the treatment area. So there should be a policy for a patient pregnancy. So this is example. I think this is pit patient. They come okay for treatment and then they cover with a gonad shield. So this is the shielding. Okay. The lid apron, they have a thickness for lid apron at least between 0.1 to 1 mm lid equivalence. This is for procedure involve X-ray energy of 100 kV. A lid apron at least 0.25 mm lid equivalent is required. So lid apron is provide protection for the whole body of the personnel. Okay, this is example of personal protective equipment that you can see. Very familiar when you come and enter the Department of Radiology. Okay, the second one is a thyroid shield. This is also you can see all this shielding in the department. Okay, you can ask the staff if you really want to see or touch this radiation protective equipment. So the thyroid shield is they want to protect the thyroid shield area. Okay, it requires 0.5 mm thickness of the lid equivalent. So commonly we use for fluoroscopy procedure. We also have a lid eye or goggles. This is to protect the lens of the eyes. So lens is very sensitive also to the radiations. Even the radiation with tissue wetting factor for the lens is not as high as the gonad, but the probability but it still can be harmful to the lens uh, uh, if they receive the excessive radiations. So example of the effect radiation to the lens is a cataracts. So to avoid this one, use a goggles. Okay, so minimum thickness is 0.3 mm lead equivalence. Okay, so that's all. So this is the reference for today's for my lecture. Okay. So that's all for me. So anyone have a questions? Is there any questions? Am I talking too fast? Can anyone respond? Am I talking too fast?
No, that.
Sorry, yes or no? Okay. I'm afraid that I might exceed the 1 hour lecture, so I talk. I try to talk so fast, and everything's clear for this lecture. So, any question? So, total student for this group is 30. Is it 30? 30 student. Okay. But if I look to the participants, we only have 26. Is it 26 or 27? Okay, it's okay. Okay, so if no questions, so thank you. Let's end our class with tasbih kifara in Surah Al-As.